This is the little folder symbol where you click to enter the information for a new patient. So in this case, what's your last name?
Sheila.
Chieler.
Iiler.
Iiler. And then we go first name. By the way, this is the IOL master. And what's your date of birth? Or I'll just put whatever.
21st of January 2002.
21st, 2002. So on IOL master as well as the ultrasound, which we will be looking at afterwards, we first go month, date, and then the year. And then you hit new. So the machine's pretty good. So if you move it to the right, you know, it kind of switches by itself, so you don't really have to do anything. So then you get the patient to place their chin on the chin rest. Just make sure it's at their level height. Usually I tell the patients to keep looking straight ahead and try not to blink and keep their eyes nice and wide. And then you try to align it as closely as possible. Make sure the dots are as tiny as possible as well. So this is the first part. So I'm going to try to move it closer to the patient or away from the patient to make sure that the dot is as tiny as possible. And then you click the top button here on the little joystick. And we get 5 to 6 measurements on here. So Robin here is a pretty good patient, so she's not moving, or you know, she doesn't really have cataracts or anything. Otherwise, you will sometimes see that there are some highlighted red measurements, so you have to delete them. And then in order to delete them, you just highlight them. So let's say, I'm gonna assume that this is a red highlighted one. So I'm gonna go highlight, delete, enter. And then I'm gonna take another one. There you go. So then hit spacebar to move on to the second part. So for this one, this is automatic, so you just click once. And you have to make sure that these measurements are within 0.10 decimal places. So they're all 4294, 4294, 4294, so that's good, we can move on. And then this part, you try to get the two light lines. You try to bring the dot in between the two light lines and make it as tiny as possible. And then you click. So they look good. We're gonna move on. And this is the last part. That's it. And then you hit spacebar again. And then you pull the machine back, go on to the second eye, and repeat. So I'm gonna make it tiny. Some people take 5 measurements, some people take 6 measurements, but as long as you're taking minimum or 5, I think you should be fine. So we're gonna move on, spacebar. Again, they look fine because they're all the same. We're gonna move on again. I'm gonna try to make it as tiny as possible and in the middle. That looks good. And this is the fourth part again. Okay, you can sit back, Robin. So this little symbol, the squiggly symbol, basically is the calculation part, so you click on it. The two that we print for our doctors are SRKT and HofferQ, which is also posted on the printer right here. And now you're gonna pick the doctor. So let's say Robin is seeing Dr. Durjan, so we're gonna click on his name. Dr. Bamwani doesn't have his name added here, so you can pick whatever doctor. So then you click on IOL calculation. You're gonna see everything fills up. Just gonna make sure that the left eye is done as well. So OD is right and OS is left. And then you hit print calculation, IOL calculation. So that's for SRKT. Now I'm gonna move on to HofferQ. I'm gonna repeat the same steps, make sure it's for Dr. Durjan. IOL calculation and print, and then you hit OK. So you're done with the IOL master now.
All right, any thing you want to add, tips?
I think it kind of, the more you practice, the more you get to know. For patients who are quite difficult, or let's say they've got Parkinson's and they've got a lot of movements, just make sure you try to get them as stable as possible. Give them breaks as well. If it's taking too long to get measurements and stuff, just give them a little break, because the light can really affect their eye and it could get dry. If you notice that the eyes are getting dry, you're gonna see some distortion on the screen, so you can tell that something's going wrong. Then you can put some Systane drops that we've got. They're moisturizing drops, so you can put them in their eyes and try again. Try a couple of times. If you can't get it, just get one of the senior staff members to help out.
Perfect.
Thanks.